Hey everyone, so today we are going to talk about drugs for neurological disorders, specifically drugs used in the treatment of Parkinson's disease, Alzheimer's disease, and multiple sclerosis. So let's get started and define what a neurological disorder actually is. So neurological disorders are either caused by abnormalities in neurotransmitter release, so abnormalities in the chemicals of the brain themselves, or the abnormalities in neurotransmitters response, the response of neurotransmitters to certain stimuli or certain outside forces. Now, abnormalities in neurotransmitter release are characteristic of both Parkinson's and Alzheimer's disease. Now, neurological disorders may also be caused by damage to nerves. So these are damage to nerves in either the central or peripheral nervous systems. So your central nervous system being your brain and spinal cord, and the peripheral nervous system being everything else. So all of the nerves in your hands, your feet, all over the rest of the body that are outside of the brain and spinal cord, those are known as your peripheral nerves, nerves from the periphery that receive stimulus and responses, and in response to that stimulus, transmit that signal to the brain where it is interpreted for a response. So damage to nerves is characteristic of another neurological disorder called multiple sclerosis. I'll get that right at some point. Sorry. So let's start by defining the first of our disorders, which is Parkinson's disease, sometimes abbreviated as PD. So Parkinson's disease is a progressive neuromuscular condition, and that usually affects patients over 50 years old. I'd say 90% of the time it's patients over 50, although some people can be younger and begin to develop it as well. I think Michael J. Fox is probably a good example of that. Now, Parkinson's disease is caused by low levels of neurotransmitter in the brain, specifically the neurotransmitter dopamine, and increased levels of acetylcholine, which is another chemical in the brain. And those chemicals, those neurotransmitters, happen to be released in areas of the brain which control muscle movement. Now, because of this abnormal level of neurotransmitter, of this abnormal level of dopamine, this level being extremely low, dopamine is partially responsible for the way we move. So it causes movement disorders. And that's what you think of when you think of Parkinson's disease. You can see right over there, there's many characteristic tremors, rigidity, a stooped posture, a masked face, because it's harder to control the facial muscles. So a lot of people have a very, very blank expression if they have Parkinson's. Bent posture, shuffling or unsteady gait, and then those fine tremors that people think of with Parkinson's disease, right? So with the hands, with the legs, and also, of course, when you have problems with muscle movement, there's difficulty chewing and swallowing as well. And it's important to note that drug therapy will not stop the progress of Parkinson's disease, but it can certainly help manage the symptoms and give these people a much better quality of life while they have to live with PD. Now, for treatments of Parkinson's disease, again, we can't cure it, but we do have our goals of therapy. Those goals being to increase the quality of life, to decrease symptoms, and minimize disabilities. So these people can continue to live fairly happy and normal lives, even if their disease might stop them from doing some of the things that they would be used to doing. So the one treatment we mainly have for Parkinson's disease is known as carbidopa and levodopa, also called Sinemet. So carbidopa, levodopa, it's a combo pill with those two chemicals under the brand name Sinemet. Now, levodopa supplements the lack of dopamine in Parkinson's disease patients, and that decreases the symptoms. So how does it work? That levodopa and carbidopa, they go into the body. It's taken orally, either as tablets, extended release tablets, or orally disintegrating tablets. So you stick them on the tongue, and they dissolve into the mouth, which makes a lot of sense, right? If you're dealing with a Parkinson's disease patient who might have difficulty chewing and swallowing, I mean, some people have problems swallowing pills even without Parkinson's disease and movement disorders. So the orally disintegrating tablets are really great because they just dissolve on the tongue and you get the same effect. What is that effect, you might ask? That effect is the levodopa, which is just a precursor to dopamine. That levodopa gets transported into the body. It crosses the blood-brain barrier, it crosses into the brain, And think of it almost like a Trojan horse, right? So levodopa is just a precursor to dopamine. You have to sneak it into the brain. And when it's in the brain, it gets metabolized by the body. It breaks down into dopamine and supplements those low dopamine levels to give people with Parkinson's disease an opportunity to have better muscle control, because it's increasing the dopamine. That low dopamine causes problems with tremors and muscle control. Increasing the dopamine increases the ability to move as you wish. Now, long-term use of Sinemet might lead to tolerance, so the dose might need to be increased later in treatment. And again, of course, it only treats the symptoms. It does not cure it, but it can give people a much better quality of life, and they can do their activities of daily living with much more ease than they would without the Sinemet. Next, we have Alzheimer's disease, which is a very devastating and well-known neurological disorder, and it's known as a progressive dementia, and that's linked to neurotransmitter abnormalities within the brain. Basically, these plaque type things build up in the brain. These quite complicated pharmacology, so complicated, in fact, that we don't exactly know completely what triggers Alzheimer's. We know some of the hallmarks, we know some of the things to look for in Alzheimer's patients, but we don't know exactly what causes someone to have or to not have Alzheimer's yet. But we do unfortunately know the effects. And as you can see on one side, we have our healthy brain right there, looks nice and healthy, but then you see the degradation, the breakdown of all of this brain tissue. And that is characteristic of Alzheimer's. It's a progressive deterioration of the tissues within the brain. And that causes the loss of memory, speech impairment, social withdrawal, because of course, if someone is unable to fully comprehend or fully contribute to a social situation where they might have been adroit in the past, of course, it can be very traumatizing, and they decline socially and decline from speaking and talking with other people because they know something's wrong. Then in later symptoms of Alzheimer's disease, you start to get what would be maybe the classic symptoms where you may require either an at-home companion or some supportive care. And that's an inability to conduct daily living activities, loss of spatial relationships. They have an inability to recognize familiar people and surroundings, as well as wandering and sometimes even aggression. So again, we want to be able to treat these symptoms as best we can. And we can only treat the symptoms. There's no cure, but we do have two drugs that are fairly effective for this symptomatic treatment. The first of those is donepezil or Aricept, and those come as tablets or orally dissolving tablets. The side effects include a lot of gastrointestinal side effects. That's the main thing to remember with that. So that might include nausea, vomiting, and diarrhea. Now, there's a risk of dizziness or falls as well, which of course can be very bad for a patient with Alzheimer's, considering they might not know exactly how impaired movement-wise they are. So you want to avoid it with drugs that might decrease the heart rate as well as if you can, because you want to avoid what's called that orthostatic hypotension, right? That's the dizziness upon standing. So if someone has Alzheimer's, they're not going to remember that they're going to be dizzy when they stand up. They're going to be very confused. A lot of times people with Alzheimer's might think that they're 20 years old again. They don't know their physical limitations. So it's important to, of course, in addition to general monitoring of Alzheimer's patients, you want to make sure that if you can avoid donepezil in patients who might have cardiovascular or drug for hypertension, for instance, or diuretics that may cause them to have that orthostatic hypotension, just make sure that they either have someone looking after them or Aricept might not be the best option. We also have memantine or Namenda XR. Always remember memantine, right? Because it sounds like memory. So it's used for Alzheimer's. It's an oral solution also available, but normally it's a tablet, and it's also, a capsule rather, an extended release capsule. The nice thing about it as well is capsules might be sprinkled on applesauce for patients who have trouble swallowing, or for patients who may just not be willing to take a pill, because many Alzheimer's patients don't believe there's anything wrong with them, unfortunately. Side effects of Namenda include dizziness, headache, and constipation, but it is quite the decent drug for at least slowing the progression of Alzheimer's disease. Both of these drugs may slow it by about 6 months. They can also be increased to decrease the amount of Alzheimer's symptoms, specifically like the aggression or the precipitation of memory loss, and they can also be taken together. So sometimes Aricept gets added to Namenda or vice versa after the patient has unfortunately progressed in the disease. Lastly, we're going to talk about multiple sclerosis, which is a disease in which the body's immune system attacks the body's central nervous system. So it damages the nerve cells, making them unable to transmit chemical signals to the brain. So if you can see right here, and this is a bit technical, but I think it's useful in sort of showing how the immune system attacks these things. These little nerve coverings are called myelin sheaths right here. It's just this little sheath of cell that covers the nerve cells. And when it's kind of like, think of like an electrical wire almost, and how the electrical wires have to be insulated in order to carry that electricity. The similar thing with the nerves, right? Because it's chemoelectrical, that is, it's a chemical electrical impulse that receives stimuli, whether it's touch or taste or what have you, pain stimuli, cold, hot. It transmits that signal, the nerve impulse, down this nerve, and those nerves, in order for that signal to be conducted down it, it needs to have this little covering around it called the myelin sheath. When that gets damaged, the immune system rather, damages that sheath around the nerve, and that's what causes a lack of impulse to the brain. So if the brain can't interpret the signal, if the signal is not getting to the brain, that's when we have the issues with MS, where we have nerve pain, we have fatigue, impaired coordination, and the symptoms get progressively worse over time. Also vision loss, potentially double vision as well as a symptom. There's no cure for MS, and it is progressive, but pharmaceuticals can, again, increase the quality of life and offer symptomatic relief to these patients who otherwise would have to go through a very, very devastating disease without any sort of help. Now, there are some treatments for multiple sclerosis. There are immunomodulators. Remember, we're working on the immune system with MS. So immunomodulators are used to suppress the immune system of MS patients. And it makes sense that we would want to suppress the immune system, right? Because if we suppress the immune system, then the immune system can't attack the body's nerves, and it slows the progression of the disease. So this keeps the body's immune system from attacking the nervous system, and it's used to prevent attacks of multiple sclerosis. It reduces symptoms, and it slows the development of disabilities as well, because after every attack, usually someone loses a little bit more of their faculties. Usually they are unable to move as easily, or that nerve damage, those nerves don't repair themselves. So if we can decrease the number of attacks of MS, then we can also decrease and make the progression of the disease take much longer than it otherwise would have. So it's giving these people a better quality of life for a longer period of time. Now, we have two drugs, interferon beta 1A, or Avonex. You can imagine why they have the brand name for that instead of the generic, right? Or glatiramer acetate, or Copaxone. Now, they're both injections. And because they're used to suppress the immune system, they have some pretty nasty side effects. They have flu-like side effects that are very common after the injection. So they're flu-like side effects, meaning they might have a fever, they might feel really crummy for around like a week after the injection. However, that's just because the immune system gets acutely suppressed. As it slowly comes back, those symptoms fade, and then they are usually able to return to their general quality of life that they had before. Now, I should say interferon beta 1A, or Avonex, is not used very much anymore because of these pretty debilitating side effects. Interferons are nasty. They're just nasty drugs. They are, however, there are some other MS drugs which wouldn't be in your top 200 drugs that have fewer side effects and that are generally better tolerated. But a lot of times, since interferon's been around for the longest, a lot of people have to start with that based on what their insurance is and how much they can afford. But you'll see these drugs in a hospital or a specialty pharmacy. They are extremely, extremely expensive, but what price can you really put on quality of life? So that is just about it for our neurological disorders. I understand it's a pretty convoluted topic, so if you have any questions, feel free to ask. Thank you very much.